Hello everyone. In this video, we will discuss top 5 diabetes scams, especially prevalent in India. Scam number 1, dairy products are harmful. So you must have heard कि आपके किसी रिलेटिव ने किस दिखाया डॉक्टर को और उन्होंने बोल दिया कि stop milk. So is it really true that in diabetes management we have to stop milk and dairy products? Let's find out the answer. So in this review article, dairy consumption and risk of type 2 diabetes was assessed. Indeed, the low-fat dairy products, especially yogurt, has shown to decrease the progression to diabetes or control diabetes. While most of the other dairy product have not shown any benefit in terms of prevention of diabetes, but at the same time, it is important that dairy product does not cause a spike in the sugar values or they are harmful for diabetes patients. So the truth is, dairy products are not bad for diabetes. Avoid full cream milk. And when should dairy products or milk should be stopped? So stop milk if someone has lactose intolerance, which we call it as milk allergy. Scam number 2. Sugar-free sweets, cakes, biscuits are good for diabetes. So you must have seen lots of marketplaces. They show that this sweet is diabetes free. Diabetes patient can consume these sweets without any problem. So is it true? These sugar-free sweets, they are indeed high in saturated fats. Saturated fat is a bad fat, and overall calories are very high in these sugar-free sweets. Sweeteners which are used in preparation of these sweets can have a laxative effect. For that, you can watch our other video on artificial sweetener. They are indeed costly also. So better to save your money. And in conclusion, the reality is avoid sugar-free sweets at all. And you can have small amount of standard products occasionally. Sometime you can have. Scam number 3, fruit diet only. So in WhatsApp groups, you must have seen that YouTube video. एक महानुभव हैं, वो कहते हैं कि सिर्फ आप फ्रूट्स खाइए and your diabetes will be under control. That is a total scam. No truth about कि eating only fruits will control your diabetes. Indeed, it can backfire. So in this review article, fruit consumption and the risk of type 2 diabetes, with the help of these studies, it has been found that fruit intake does not help in excess of fruit intake does not help in diabetes control. Neither these fruit intake they predispose to diabetes. Moderate intake of fruits will not cause diabetes. So truth is, fruits in moderate quantity can be taken like 2 or 3 serving in a day. There is no conclusive evidence that fruits they impair diabetes control. Indeed, lots of fruit or fruit juice can have high fructose, and high fructose in turn lead to high triglyceride values. Scam number 4, shift to only millets, stop wheat. जो हम wheat इतने सालों से खाते आ रहे हैं, तो आज आ रहा है कि आप wheat छोड़ दीजिए. तो क्या इसमें कुछ सच्चाई है? Let's discuss. So the thing which is important for any grains or cereals is the glycemic index. So glycemic index ki is ki how fast blood glucose level increase after consumption of a particular meal or a particular cereal or grain. So let's compare these glycemic index. First is pearl millet, which is bajra. So glycemic index is 54, and glycemic index of till 55, below 55 is good glycemic index. 55 to 70 are moderately high glycemic index, and more than 70 is a high glycemic index. So our aim will be to have a diet which is having cereals which are low in glycemic index. Glycemic index for ragi is 55, for jowar it is 62. Now come to the wheat. Glycemic index of whole wheat, it is 45. So you can see it is lowest among all these cereals. Now the second aspect is the nutritional value of these grains. Pearl millet, that is bajra, it is high in magnesium, potassium and antioxidants. while wheat is high in fibers as well as B complex are there in wheat, iron and zinc. Ragi is rich in proteins, calcium, iron, and antioxidants, and jowar is rich in fibers, iron, calcium, potassium, and phosphorus. So that means that each grain has a different nutrition value, which is important for a normal individual. Conclusion, consumption of whole grains and risk of type 2 diabetes. So whole grain include everything, including the wheat. So it has inverse relationship with the diabetes. That means ki more of whole grains will have a good diabetes control or prevent the diabetes. Now, in conclusion, there is no need to stop wheat. Avoid wheat if someone has wheat allergy, or which we can call it as a gluten allergy. And every grain has different nutrition value, which is important for health. So you can take any of these grains. There is no need to stop wheat at all. So these grains or the diet should be individualized. Scam number 5, we will reverse your diabetes. So many patients, they are fed up taking medications, monitoring their sugar levels, going to the doctor. So they want some magic ki their diabetes can be reversed. They ask these questions, or their diabetes can be cured. So is it true that diabetes can be reversed? So what is the meaning of a reversal? Meaning of a reversal or cure is ki that particular disease is completely gone. There is no need to take any medications, and there is no need for any monitoring. So is it true? So the answer is ADA guidelines or Diabetes Care Journal has released this publication, in which they have not promoted the word of reversal. They have given a word known as remission of diabetes. So the meaning of the remission of the diabetes is HbA1c below 6.5 for at least 6 months after the cessation of glucose lowering pharmacotherapy. So remission is possible, but if individual is not doing lifestyle modification, diabetes can come back again. Sugars can be uncontrolled. So in conclusion, there is nothing like a reversal or cure. So use your wisdom before going for these programs. Medicines can be stopped, but lifestyle modification should be on a continuous basis. So hopefully with these top 5 scam and the real truth behind these scams, you will be able to take a correct decision in the management of your diabetes. If you have any further doubts or queries, you can put in the comment box. Thank you.